Hello, hello, testing. Hello, hello, testing. Looks good. Good morning. Today is Saturday. Today is March the 5th, 2022. This is our regular yoga therapy session, which we've been doing for a long time in person. Now this is all virtual after this pandemic. We have a vast experience of yoga therapy from our practice, from our research, from our connection to all the yoga therapy centers here in the United States and all over the world. And we bring a session every Saturday based on our experience. As we all know, that a regular daily practice of yoga, which is primarily a philosophy called Yoga Sutra of Patanjali, 196 sutras or small aphorisms, of which 193 is to quiet down your mind. The word yoga means the union of your body, mind and spirit, and the practice is 8 limbs practice called yam, the social restraint, niyam, personal restraint, asana, external and internal alignment of the poses, pranayama, pranayam. Prana is a life force, yam is a controlled restraint, pranayama is a voluntary regulated breathing, pratyahara, prata means reject, ahar means input, rejecting your 5 senses, quieting down your 5 senses called pratyahara. Focus is called your dharan, and then dhyan is your meditation, which is the 7th limb, and finally the 8th limb is called samadhi, union of your body, mind and spirit. So the whole practice is designed to end up in a meditation in the 7th limb and finally your samadhi. So today's topic is yoga therapy and effortless meditation. This is our experience. What we have seen from our experience is the real morbidity. Morbidity means the disease which are really affecting us at this time of our life is due to your high sympathetic tone in our body, which is called fight or flight response, and primarily that is what we call a stress. Stress is a fear of unknown, and when you have that fear, and many a time it's a subconscious. My children is going to school. I don't know whether there will be a mass shooting. I'm getting into a plane. I don't know where I'm going. Plane might turn around. There may be a person with a COVID-19, and all this fear of unknown creates a fight and flight response, which in turn through in your emotional brain, we call limbic system, hypothalamus, pituitary, adrenal axis, creating more cortisol and producing is called a metabolic syndrome, which is a truncal obesity, diabetes, hypertension, coronary artery disease and atherosclerosis, high cholesterol called dyslipidemia, and that is essentially killing us. Meditation per se is a parasympathetic activation like a regular yoga therapy practice. Yoga therapy basically means the adaptation of the yoga practices based on the patient's or client's clinical condition. We are not rediscovering anything. We are using the same your philosophy, we are using the same 8 limbs, but we learn how to use them properly at the time of your disease. Remember, disease. So the treatment of a disease in Sanskrit is called ashuk. Aw means no, shuk is the happiness. This treatment of a disease is called the effortless ease. That effortless ease is your effortless meditation. It's a wonderful connection. So we have seen people. So before the practice, we'll do a little practice of meditative practice today. Let's talk a little bit about the meditation. People all comes to us. Oh, I want to do meditation. I heard the meditation has this. Yes, meditation has a wonderful effect. In yoga therapy, primarily we use asana, pranayama, meditation. So if you think about metaphorically, the yoga therapy is like a pill. Asana is a pill, preparing our breath and the mind. So what is the asana for yoga therapy? Asana for yoga therapy is called sthiram sukham asana. Sthiram means called stillness. Sukham is the happy. Asana is the pose. Here I am. I've been practicing long time, practicing enough. I'm able to sit down in a cross-legged position. I'm sthir. Sthir means if you create an imbalance in your physical body, too much tightness of the muscle, too much tightness of your ligaments, it will cause, the muscle will cause some contraction called fasciculation. So you will feel there is a, twitching. But eventually with the practice it goes away because you develop what is called a neuroplasticity and you develop a profound level of relaxation. So it becomes stillness. Sukham, you're happy. You are comfortable sitting in this pose. This is a pain-free pose. This is a pose I can sit down for hours and hours. And asana is able to be a grounding pose. This happens sequentially, and this happens because we believe in the term that in stages impossible become possible. It happened to all of us, it will happen to you also. So, as you know, people who are following me for a long time, I always change my foot. That is called a balance, yogic balance. On two sides of the brain, you like to create a balance. Health is defined in yoga is a balance of your body, mind and spirit. So for the meditation practice, you need to prepare your physical body. Sitting down in a chair, or even sitting down here, closing your eyes, paying attention to your breath is not going to create a meditation or the effect of meditation, because you'll be interrupted with a physical body sensation. Pain will interrupt your meditation practice. A sensation in your body, like if sitting down, if you feel some numbness or feel some, pins and pricks and pain, or whatever sensation you get, will interrupt your meditation practice. So this sthiram sukham asanam, stillness, happiness asana, brings a profound relaxation in your physical body. It's called a relaxation response. So when you try to do asana practice, people say you're putting your body in a pretzel, turning, twisting, putting your head down, feet up. It all happens because you enter into that state in stages called neuroplasticity. People who start in a yoga therapy, we said, you start where you are. Have a asana practice without any pain, with a little discomfort, which is called a comfortable discomfort, but effortless breathing. So our breath is both conscious and subconscious. I'm sleeping, I'm breathing. Involuntary movement, that is through your brainstem, autonomic nervous system. I'm awake, alert, I can do a voluntary breathing. I can breathe out first, take a deep breath in, completely breathe out longer than breathing in. So the body is relaxed. Like when the body is relaxed, we do a very simply, it's called a Paschim Namaskar. Prayer pose to the back. Put your hands to the back as a prayer pose. I can do it even sitting in a chair, close my eyes, and my breath becomes completely effortless. As I have shown you, I think last session, that we can do all kinds of breathing. We can do a little slow, your bellows breathing, Bastrika, we do very fast bellows breathing, but they all feel like that we is our normal breathing. There is no effort, and that takes you to the state of meditation. So we'll do a practice where you go sequentially from asana to pranayama to your pratyahara, control of your senses, then dharan, the focus, and then entering into a meditation. So that will be a profound, effortless meditation practice. So what happens in meditation is that our mind has a thought process, and thought process we generate on our own. I'm thinking, and I have to come to this class Saturday, it's March the 5th, it's at 9:30 in the morning. It is always chattering my mind. Another important thing is most of our thought process are in the past. What did I do? What did I say? What happened to my relationship? And all with your past. Majority thought process the future. What will happen? I'm going here. What can I expect? We have very little thought process in the present. As you all know, yoga says, live in present to be healthy. Yoga therapy is a respected and recognized specialty at this time. But interestingly, even the thought process in the present, majority of them are repeat thought process. What does a repeat thought process means? That I have to come to this class, I have to teach the class, it is continuously chattering my mind, which you call a monkey mind. You think about what happens in meditation when your body is completely relaxation response, when breath is effortless, when the breathing rate comes down. Very important meditation concept, breathing rate. Like we practice, we can breathe out almost like a, say, 10 seconds, even 15 seconds out, then we get the 7-8 seconds in. Our breathing rate sometimes is 3 to 4 a minute. Normal breathing rate is about 15 to 16. Very simply, you can breathe out 4 seconds and breathe in 2 seconds. Count of 2 in, count of 4 out, your breathing rate will drop down to 10. It will generate a parasympathetic relaxation response. So in meditation, what happens? You enter into the gap. You enter into the gap in between the thought process and you started expanding the gaps. So what happens, you are never a thoughtless. It's a misnomer. Thoughts are always there, but our thoughts are now in a file and a folder, and it is according to the proper use of that thought process. So metaphorically, what we say, that our present state of mind is like a fall, like a Niagara Fall. When Niagara Fall water comes down, it gets into a river. What is happening? All the turning, churning of the water of the fall now is quieting down. Now, river has a small branches and essentially end up with a small your area which almost looks like a pond, and where the water is completely standstill. You can throw a little stone in the water, you can see all the ripples in the water. So essentially, metaphorically, in meditation, mind becomes from a Niagara Falls or a falls to a river to a small, quiet water like in a pond. Very, very important concept. And that stays with you all the time. So the mind, let me talk to you a little bit more because it's a very important concept. Mind in yoga is the content of your 5 senses. The 5 senses, we hear, we see, we smell, we taste, and we touch. When you see all the contents of your 5 senses in a place that is called your mind, when those information, which is called ahar, see, 5th limb is called pratyahar. Prata means reject, ahar means intake through your 5 senses. When those information gets properly processed, it becomes your intellect, which in Sanskrit called buddhi. It's very intellectual. That means we were able to process the 5 senses input properly. When those information get further processed, that becomes a wisdom. Anandamaya kosha, wisdom. Wisdom is the person who are able to respond appropriately with the intake of 5 senses. It's a self-realization and spiritual liberation. It's a wonderful concept. So what is the proper effortless meditation to be healthy? In an effortless meditation, you will be learning how to control your 5 senses through different techniques. And to get the effect of it, you will be using a health tracker, and you will see in the health tracker your heart rate is coming down, your sleep pattern will be better, you will have a deeper sleep than the light sleep, your EKG will have a absolutely normal EKGs, and also when you are doing meditation, if you're doing like a mudras, when you touch tip of your fingers, essentially when you're in a meditative state, slowly and slowly you will feel the sensation of your skin is slowly and slowly going down. You won't even feel the touching the two fingers. People like us, we're a vascular surgeon who have been feeling pulse in the body all the time. Normally, in a awake state, I don't feel my pulses, but when I'm in a meditative state, I can feel, that's called a capillary pulsation. The pulsation at the tip of the finger, I can clearly feel it. I already started feeling it because I have some saliva in my mouth. Saliva in the mouth, it says that you are in a parasympathetic activation because all the salivary glands are supplied by parasympathetic nerve. So, let's think about what is an effortless meditation. As I said, effortless meditation is effortless ease. Your state of mind will be such as that you are not going to react to your surrounding. So given for the example, what happens in effortless meditation is that, okay, this is a nice example. Somebody like maybe at your work, your friend, somebody comes and starts screaming and yelling at you. What do you think? I'm not a problem. He or she is the problem. He or she did not sleep last night. He or she probably had a fight with the spouses or the children. Or he or she is carrying some emotional garbage. And when they saw me, they thought I am the trash can and they're dumping all the emotional garbage on me. So what happens to me, instead of reacting, I convert into a meditative practice and a negative thought process. And what happens? I have done all this completely effortlessly. I did not make any effort at all. I drop a glass from my hand, I broke it. It was time for that glass to go. Yeah, if we need, we'll go ahead and get another glass. Instead of saying, oh my God, what did I do? Why did I throw it? That increases your heart rate, increases your blood pressure, increases your sympathetic tone, creating the metabolic syndrome morbidity which is killing us. A simple technique of effortless meditation, able to quiet down your five senses. So, for example, any asana you do is a meditative asana. It doesn't matter. You are doing a triangle pose, Trikonasana. If you do a triangle pose in sequence, remember, alignment is not the issue. Alignment will come to you. But you will be able to stay in that asana pose effortlessly without any pain. Breathing should be exhalation longer than inhalation and able to stay there long enough that that asana will take you through pranayama, pratyahara, dharan, dhyan. That asana will take you, called your voluntary regulated breathing, control of your five senses, focus and meditation. Remember, again and again I'm telling you, you cannot sit down and do a meditation unless you prepare your body and breath. So, You sit down. So here I am, I'm sitting down in a Sukhasana, easy pose. From this pose, I'm going to enter into a state of effortless meditation. What are the steps? You do the practice all the time, same practice, but I'm guiding you how to do it. So start it here, or you may be just starting, or you may be sitting in a chair, you are going to do it. The first, it has to be pain-free. Little discomfort, it's not like that you are very comfortable, you are not comfortable. At the beginning, little discomfort, which is called a comfortable discomfort. If you have a pain, back off. Find a place where you are able to be pain-free. Then pay attention to your breath. Your breath has to be completely effortless, exhalation longer than inhalation. The moment the breath has an effort, it will awaken your mind. Remember, breath is the connector between your body and the mind, because breath is both conscious and subconscious, voluntary and involuntary. Metaphorically, breath is like flying a kite. When you're holding the roller to fly a kite, roller is your body, the kite is the mind, and the thread which connects the roller and the kite is your breath. So breath has to be completely effortless. Rate of breathing has to come down. Normally rate of breathing is about 16, slowly and slowly come down. I have seen people sitting next to me, a meditative practice, a long meditative practice. I mean, they've been breathing, you really don't know even they're breathing. They'll be breathing maybe 2 or 3 breaths a minute. You still don't know they're breathing. Lower the breathing rate, longer your longevity. Look at animal world. A dog breathes 30, 40 breaths a minute, lives only 18, 20 years, 15, 20 years. Turtle breathes maybe about 2, 3, 4 a minute, lives 100, 200 years. And Grand Master is very simple. God gave us X number of breaths. You use it too fast, you're going to go. You use it slowly, you'll live longer. You live longer to use the X number of breaths. So here I am. Hand controls your body and mind. Mudras, spiritual gesture, are called psychophysical connector of your prana. Prana is a energy, which is a life force going to different organs. So practice it with me. Touch your index finger and thumb, put it over your knees. Close your eyes. Out of the 5 senses, most powerful sense is your vision. The moment you're able to quiet down your eyes, you quiet down your mind, or even we call it even your brain. Why? Eye is a direct extension of your brain. Eye connects with a huge big nerve, it's called optic nerve. Optic nerve goes straight to your brain, it's a part of your cranial nerve. So we said our brain is covered by a bone called your skull. The portion of the brain which is we can see is your eyes. Same way we say, when the eyes is the part of your vision, breath is part of your mind. Close your eyes. Now bring attention to your breath. When you are doing this hand mudras, able to control your five senses, your breath will be completely effortless. Lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to keep it open, and it has a 4.5 liter of gas which can be exchanged, which is called a vital capacity. Normal breathing, we only breathe 500 cc or half a liter. Large number or amount of air which you breathe in also sitting in the top, which is called a dead space. So the lung is full of this carbon dioxide and other toxic gases. All the gases also comes from our all different organs. We have found out by analyzing the out breath, we can make a diagnosis of 450 diseases. So learn how to breathe out first. Take a deep breath in. Breathe out longer than breathing in. You will see slowly you'll be able to breathe a lot longer than breathing in. Exactly what I was telling you, I'm started feeling the capillary pulsation at the tip of my fingers. I also can look at my heart rate. I'll be able to see my heart rate is coming down. Heart rate started to come down already. Then you do your breathing in sequence to reduce your breathing rate, but completely effortlessly. First you can do count of 2 in, count of 4 out. 2 seconds in, 4 seconds out, your breathing rate already will be 10. And if you practice it daily, you will be developing neuroplasticity and you'll be breathing like that same when you're even sleeping. Simply breathe out first. Always remember, in all yoga practice, you breathe out first. Breathe in with a count of 2 in. 1 and 2 in. Count of 4 out. We've been practicing for so long that it became so completely effortless for us, the breathing. For you, you practice for a few weeks. Neuroplasticity generally needs about 20 to 30 input in your brain. The brain changes. You know, neuroplasticity means, see, I'm sitting down here. I'm not sitting down. My brain is allowing me to sit down because I've been practicing for a long time sitting like this. So give you an example for us. I can do 4 seconds in, 8 seconds out very easily. Breathe out first. Count of 4 in. Count of 8 out. I'm still talking, I'm still singing. That means my breath is effortless. When breath is effortless, you'll be able to talk, you'll be able to sing without any interruption. When you're doing it, keep doing it, and then you'll see the effect of it. Don't make any effort in a breathing. Effortless ease. Okay, count of 6 in, count of 12 out. Breathe out first. Six-second in, 12-second out. So your breathing cycle is almost 18 seconds. So just a little over 3 breaths a minute. We've been practicing so long, we can even do 10-second in, 20-second out. Breathing rate will drop down to 2. We show you one, maybe do a 8-second in, 16-second out. But remember, you have to empty your lung first to get the air in. That happens. Why we're always hypoxic, we don't have enough oxygen, because the amount of air we do in is called a dead space. It's sitting down there. We can increase our tidal volume, the amount of air you breathe in, 3 times, 4 times. Breathe out first. Then count of 8 in, count of 16 out. That was count of 8-second in, 16-second out. So when you progress like that, what happens? You are so relaxed, then you can go back to your, progressively you can do the asanas. Next is called Siddhasana, perfect pose. You take your heel to the back, you put your one foot on the top, other knee drops down. You don't push it down. If you push it down, it'll come back higher. So if you keep doing the same stages, this is called a Jnana Mudra or a Dhyana Mudra, meditation mudra. If the eyes closed and follow your breath. For all of our practice we do, always try to do our practice with the eyes closed, because the meditation, effortless meditation will come in, and what happens when you're able to do a meditation for a short time, it lasts throughout the whole day. Balancing both sides of the brain is a meditation, because a brain cannot function when one side is more active than the other, which will happen. I'm right-handed, my left side of the brain is more active. But think rationally. If our brain is like a bicycle, bicycle needs a movement for balancing. So all the movements you do, including the asanas, are also a meditative practice to keep you in balance. A bicycle or a bike will function properly when both of their tires are properly inflated. If one tire is not properly inflated, it won't function properly. Okay, so same concept. So to the other side, it was left one first, put the right one now. perfect pose for your asana practice. So once you can do this slowly in stages, you will see you progress. Progressing it to your half lotus, Ardha Padmasana, or a swastika asana. If a pain in this, I back off. Find a spot, or even a part, I put even maybe foot down here, there's no pain. But sequentially I keep on doing it in stages. Generally in the practice, we put our fingers in between the toes, that when the toes gets relaxed, our whole body gets relaxed. Hand get relaxed, body get relaxed. Remember, whole yoga practice is holistic. Holistic means whole. It affects your whole body. It is not reductionist. I'm trying to separate my toes, only toes will be like, no. It affects throughout the whole body. It's beautiful. Go to the opposite side. So, look at the opposite side. Same phenomena. Mudras, closing your eyes, breathing out longer than breathing in, because breathing out is parasympathetic and breathing in is sympathetic. Longer the exhalation, longer your longevity. Lower the breathing rate, longer your longevity. So now you are in a relaxation response enough that you will be able to get into what is your lotus pose. So remember, getting into the pose in and out is very easy. We can do it. But getting into this in stages are more important. So you have to do in stages. So once your body and breath is prepared, you have a very quick way to an effortless meditation. Okay. So if you're practicing with me, let's do it and I'll guide you. We have 5 senses. We see, we hear, we smell, we taste and touch. And Sanskrit is called your Shabda, Sparsha, Roop, Rash, Gandha. Shabda is a sound, Sparsha is a touch, Roop is your vision, Rash is your taste, Gandha is your smell. Now, put your tip of your index finger and thumb, close your eyes. Wherever you are, whatever is your surroundings, closing your eyes, you visualize 5 objects. Here I'm in my office. I can visualize I'm in front of a laptop. Closing my eyes, I can visualize my laptop. I can visualize I have a musical instrument behind me. It's called sitar. I'm visualizing the musical instrument. Visualizing my yoga mat. I'm in front of a window. I'm visualizing the nature. I'm visualizing the color of the wall. Visualize 5 is called your guided visual images. Now you go ahead and touch the 4 objects you have visualized. Closing my eyes, I'm touching my laptop. I'm touching the musical instrument. I'm touching that yoga mat. I'm touching that wall. Now you smell 3 objects you are touching. Now you smell 3 objects out of 5 which are visualized. I'm smelling the fragrance of the flower which I'm visualizing through my glass door. I'm smelling the smell coming out from my yoga mat. The rubberish smell, I can smell it. I'm smelling the wallpaper of the wall, which has a little bit of a different smell than the surroundings. Now smell, after 3 smells, hear about 2 objects to visualize. Hear the sound of the nature. Bird chirping, the leaves are moving. Whatever I'm looking through my glass door, I'm hearing that sound. I'm hearing the sound of the string instrument called sitar, which is behind me. Finally, I test one object I'm looking through. I'm looking through my glass door. In my nature, there is a lot of fruit tree. I'm looking at them. I'm tasting one of the fruit from the tree which has fallen into the ground. I'm totally quieting down my 5 senses, which is my mind. When this get more processed, I develop intellect called buddhi. More processed become wisdom, self-realization and spiritual liberation. Meditation comes from focus. What are the focus you have? All the focus just we have done is the same focus called visual imagery. You have an image on which you can focus. You're sitting in front of an ocean. Focus on the blue sky in front of the ocean. Sitting in front of a mountain, you are focusing in the tip of the mountain. Sitting in front of a candle flame, you're focusing on that candle flame. Focus on your breath. Breath-centered meditation. We all breathe through our nose. Do not breathe through our mouth. If you breathe through your nose, all the air goes to your lung. Breathe through your mouth, air can go into your stomach and the lung, you don't know where it has gone. So visualize at the tip of your nose, you're breathing out first. Visualize you are breathing in through your nostril. Nose is like your filter. All the dirt from outside is getting filtered in your nose. Nose is like your personal air conditioner. Outside air is warm, it will cool it down, and outside air is cold, it will warm it up. Air goes to the side of your nostril called turbinate. Turbinate guides the air and converts into a vortex. Vortex goes over the mucous membrane of your sinuses, where it releases nitric oxide, which is a potent vasodilator. It opens up all the blood vessels, and it is also an activator of your parasympathetic tone. Other few substances, the activator of parasympathetic tone is cyclic GMP, acetylcholine. Air is going through the larynx to upper trachea, upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. Pause there. It's called Cable Kumbhak. And visualize the air is coming from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, and coming out to the back of your nostril through the nose as an exhalation. Outside the nose, it picks up prana. Prana is a subtle energy which keeps us awake, alert, and alive. Prana is not your breath. Metaphorically, prana is your like an electric energy, and breath is like electric cable. In yoga therapy, our whole body does the breathing, not only lung. So bring the prana inside your body and take the prana to the organ of healing. If you're underlying metabolic syndrome, underlying condition, like for me, I have a heart disease, I'm visualizing prana is coming to my heart to cause us pranic healing. If you have back pain, you visualize prana is coming to your back to cause us relieving your back pain. Diabetes, you visualize prana is coming to your pancreas to balance your beta cells insulin output. You also can focus with your alternate nostril breathing without closing your nostril. That is called meditative alternate nostril breathing. Like when you visualize you're breathing out through your left nostril. Breathing in through your left nostril. Breathing out through your right nostril. Again, visualize through your right nostril. Visualize breathing out through your left nostril. So able to visualize alternate nostril breathing is your meditative alternate nostril breathing. Silence quiets down your five senses. You can sit down again in called sthiram, sukham, asanam, stillness, happiness, asana pose, and can close your eyes and stay in silence. Silence will take you to meditative practice. Our brain has a frequency. You create another frequency. Two frequency interacts and quiets down, which is called your harmonic resonance. It is called chanting, or called a mantra. In Sanskrit, mantra, man means your mind, and tra is a container, called a patro. Mantra means container of your mind. Yoga gave a sound called your Om. Sound of Om is called A, U, Ma, A, U, M. Or Yoga gave us called a Bhramri Pranayam, like a bumblebee breathing. When you do it like a bumblebee breathing, you also quiet down all the frequencies in your brain. So the meditative practice, first is that your spine straight, Merudanda Achal, Manasthir, eyes are closed, hands are touching into a mudras. Then you can do a very continuous, like you breathe out first, then you will take a deep breath in and breathe out with the sound of Om. You do it a few times, you will see the effect of it in your body and mind. You also do a focused meditation through a body scan, which we will do. We'll lay down on the mat. We'll do a body scan, focused meditation, doing a deep relaxation technique. The difference between Savasana, corpse pose, and Yoga Nidra. Yoga Nidra means yoga means yoga, Nidra means your sleep. That means you get all the effect of your sleep without sleeping. Same with meditation. Meditation, you get all the effect of your sleep without falling asleep. Mindfulness meditation. Mindfulness meditation means you are paying attention to what you are doing and keeping your mind completely closed of other senses, called pratyahara. I'm reading book, that's what I'm visualizing, all my other senses are shut down. I'm cooking, I'm paying attention to the cooking and the spices and the sound and rest of the senses are all shut down. Paying attention to what you are doing is a mindfulness meditation. Moving meditation, I've told you all the time, I've shown it to you, you're walking. Pay attention to what you're walking. Put your one step first, then the other step. Put the right step first, then the left step. Then the right, then the left. The moment you pay attention to her walking, that becomes a walking meditation. Moving meditation, we have shown it to you. We do call it, we stand up, we call it a west rotation, called Kati Chakrasana. And our hands like that, we move our hand, the eyes closed with the breathing. Like you breathe in here, breathe out slowly, closing your eyes. Very good for people with kapha, moving meditation. Deep relaxation meditation. Deep relaxation meditation is called an instant relaxation technique and a quick relaxation technique and the deep relaxation technique. Instant relaxation technique you do at the beginning of the asana. Primarily you do with a little savasana or the corpse pose. Quick relaxation you do generally sometimes in the middle or generally end of the asana or yoga practice, and finally deep relaxation technique, which is controlling all the 5 limbs, all the 7 limbs of the yoga to enter into a state of meditation and through a yoga nidra. Wonderful, wonderful practice. So remember to get into the yoga nidra and get into meditation. As I said, you get the same effect of sleep without falling asleep. Remember, sleep has a 2 components. REM sleep, rapid eye movement, and it's called your non-REM sleep. In rapid eye movement, the mind is still awake. You get all the dreams. It's a non-REM sleep which gives you all the effect of sleep. During the sleep, it's like body gets recharged. During the sleep, you get a more growth hormone release. During the sleep, your whole body relaxes. During the sleep, your body core temperature comes down. During the deep sleep is your pure parasympathetic activation. Non-REM sleep has 4 stages. Stage 1, stage 2, stage 3, stage 4. Stage 1 and stage 2 are almost 50% of the non-REM. So stage 3, stage 4 are the deeper sleep. So when you use a health tracker, it will show you the amount of sleep you have. It will show you amount of your deep sleep you have. And that's what it counts. So people who are practicing yoga, especially all the yogis and rishis we see, they're in a meditative state throughout the whole day. They don't need to sleep much. Yogis don't sleep much. Because when they sleep, they basically need the deep sleep. So if you talk about even a 6 hours or 8 hours, people ask me how long I'm going to sleep. It's not how long you're going to sleep. What is the quality of your sleep? It's not the quantity. 6 hours sleep is good enough. So 6 hours, if you look at it, 75% will be your 3/4. So a little over 4 hours, half of it. So 2 hours. The 2 hours is the deep sleep you need. In stage 3 and stage 4, non-REM sleep, you're there. So throughout the whole day, you're in an effortless meditation. Your you don't have any sudden rise of heart rate, sudden rise of your blood pressure, which is the most drastic and which is killing us. Let's finish with the practice of Yoga Nidra, which is guiding you to the proper effortless meditation. So let me show it to you. Hopefully you'll be able to see me. So first you lay down. When you lay down in the ground, be sure your chin is little down. That your chin is not high up like this. If you're high up like this, put a little small pillow underneath. Remember, it's effortless ease. Don't make any effort for the practice. Separate your feet up to the width of your mat. Put your hands on both sides. Okay. Put your hands on both sides. Palm facing high up. And all the fingers are separated. Bring the same sequence, closing your eyes, bringing the relaxation response, and slowly you enter into a savasana. This will have your instant relaxation technique. You can do it before starting your yoga practice. In a quick relaxation technique, what you will do, you will be doing in the middle or at the end of the practice, you will use the muscle contraction of your whole body and then your breath holding and let go. Like you are in a state, you contract all the muscles of your body. Contract your lower part of the body, contract your hip area, abdominal, chest area, contract, and then you get a big breathe in. Let go. You contract. You do a contraction and relaxation of the muscles and blow out all of your breath. You can do your hands and the feet, all the contraction. In a deep relaxation technique, which basically we're bringing the Yoga Nidra in your body and mind. Once you're able to lay down comfortably in Sthiram Sukham Asanam, eyes are always closed, bring your attention to your abdominal breathing. You will see during a breathing pranayama, if you look at a baby very relaxed. Even now I'm feeling very relaxed. I can put my hand, I don't have any even resistance in my body. So abdominal breathing is relaxation. It is a parasympathetic activation. Chest breathing is improving your lung function. So if you practice, you can put your hand near the belly button. When you breathe in, your abdominal wall will rise. If you see a baby is sleeping, that's when the baby sleeps. Breathe in, abdominal wall will rise, and breathe out. Don't go in. Once you bring the abdominal breathing, you continue for a while. Then remember the whole breathing, yogic breathing is, you're breathing out first, exhalation longer than inhalation. You can also use some breath holding, both in inhalation and exhalation, which brings better relaxation. We call it a murcha pranaya. Slowly enter into your fifth limb, is called pratyahara. Pratya is the reject, ahara is the input. How to do it? We did it on sitting posture. You have 5 senses. What we have done, we visualize 5 objects around us. We touched 4 objects. We listen to the sound of 3 objects. We smell 2 objects. Then we taste 1 object. It's called pratyahara, control your 5 senses. Takes you to a 6th limb called dharan or focus. You can do it called visual imagery. You can visualize image. Best way is your flame of a candle, looking at a flame of a candle. Eyes are still closed. Or focus with a very gentle chanting. If you have a spiritual meditative practice, you have a contemplative prayer, you can do it. If you're Sufi, if you're doing any namaz, you can do it. Jewish Kabbalah can do it. If you know a mantra, you can do a mantra, because man is the mind, tra is the container. Om Dhur Bhuvaswa Tat Savitur Varenam Bhargo Devasha Dhimai Theo Yona Prachodaya. Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kashchi Dukkha Bhavavane. All about health. Slowly you enter into a state of meditation. Stay a little bit. You are already relaxed. You have done an extremely good body scan. You can do it again. You can relax the tip of your toes, relax your feet, relax your leg, relax your thigh muscles, your hip areas, abdominal areas, chest areas, your neck, whole head and neck, shoulder, elbow, hands. This whole place has a solitude. It falls down. There is no resistance. Slowly you wake up with all your body movements, moving your fingers, moving your toes. Slowly turn on your left side. This left side is, and put your hands, head under your head. Eyes are closed. On your left side is the right nostril is open, which is sympathetic, which is Surya Nadi, sun energy, which is warm. It's trying to balance the coolness and relaxation of your yoga nidra. Inferior vena cava is on the right side. There is no pressure on inferior vena cava. There is a better return of the blood into your heart. It's called increasing preload. And because of the relaxation, you are reducing the peripheral resistance. It is called reducing afterload. Increasing preload, reducing afterload, your heart function gets better, ejection fraction gets better. Slowly straighten up your right leg. Just push your body high up and sit down in the nice your easy pose. The final practice is called thumbing and cutting, which is very important for your effortless meditative practice. When you're rubbing your hands, you're generating your heat. If you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes like a cup. Let the eyes take all the heat from your hand. With the hand heat, the eyes get relaxed. There's a muscle inside the eye called ciliary muscle, which controls your lens. Relaxing the ciliary muscle, the lens curvature gets bigger. It's almost like a reading glass. We don't need any glasses when you practice yoga. Slowly massage your forehead, massage your eyes, massage your face. All the muscles here are attached to your skin. So all your lines, frowning, which goes away. Take your hand slowly, massage behind your ear, in your earlobe, in front of the ear, even inside the external auditory canal. There's a branch of the vagus nerve called auricular branch, which causes vagal stimulation, parasympathetic activation. Bring your hands, massage on both sides of the neck. This is called massaging your carotid sinuses. Massaging carotid sinuses quiets down your cardiovascular system, nervous system, brings a profound relaxation response. Take your hand to the back, massage at just below your occipital tubercle, with the insertion of the trapezius muscle and sternomastoid muscle, which are supplied with the cranial nerves. It quiets down your body and mind. Throughout the whole day, you will be looking at your health tracker. Your blood pressure will be normal, heart rate will be normal, and finally, just to show, we have an EKG here. Let me do one strip of EKG after whole practice and see the effect of it on my body and mind. Can't be any better. Perfect. Heart rate is around 70, sinus rhythm. This EKG does not show any sign of atrial fibrillation. So these are the factors And we do all of our practices with this health tracker. I don't know if you have seen any of this. If any of you have this, it's very hard to show it to you. But anyway, if you have one of these, you'll be able to do it. Like here I am. I have to. Okay, thank you for participating here on the Saturday, our discussion, and we'll be here every Saturday. So unfortunately, in the next few weeks, I may need to be out of town for a family emergency. So I will inform through your Facebook Live when will be our next Saturday morning class. Thank you for your participation. Any question, please put it in my Facebook page and I'll be able to answer for you. Thank you.